Hello guys, in our previous video we learned some risk factors to develop aortic aneurysm, and today we're gonna go over each one of them to understand what can we do to prevent this disease. Smoking, being a male, family history, atherosclerosis, hypertension or high blood pressure, diabetes, hyperlipidemia, and age. These are all risk factors to develop aortic aneurysm. From all of these different risk factors we just saw, the modifiable and non-modifiable ones, they all have something in common. They all produce a vascular inflammation, bringing to an immune cell infiltration like cytokine production, activation of complement, cascade, and then degradation of extracellular matrix, which is going to bring to a smooth muscle cell apoptosis, and that's going to weaken the wall for the aneurysm. Let's see a practical example with this clinical case.
Hello there. My name is Mr. Beasley. I am 68 years old, retired, single, and today I come here because I heard there's a doctor to be out there. What's her name again? Oh yeah, Ronaldo. That could help me with this problem. I've been experiencing severe belly pain that is preventing me to sleep night to night. I want to know what you know. What can you do to help me with this? You know what I'm saying? If you have something to give me. Actually, I do have something here doctors already gave me. So right now I'm taking different medications, and I'm taking the one that's called atorvastatin, enalapril, atenolol. Let's go get them. So this is basically all the medications I've been taking lately. All of them, including the one for the prostate. You know what I'm saying? So I want to know if there any other solution instead of the medication, because actually the one for the blood pressure is not working on me. So if you have something to tell me, lady, I would appreciate it. Thank you very much.
Well. Let's see if is there anything we can do to help Mr. Peasley. Now the question is, what are the risk factors can we identify in this man that put him in a higher risk to develop aortic aneurysm in the future? So please comment below all the risk factors you can identify on this man. So let's go ahead and take a closer look here. So Mr. Peasley is over his 60s, he's a male, smoker, taking medication for his high blood pressure and high cholesterol. So we can see he has pretty much all of the risk factors to develop the disease. So now, my beloved fellas, that we understand that Mr. Peace has all the risk factors to develop the disease, what are the things we can recommend him to do? What would be our assessment plan for Mr. Peace love? Well, first of all, we have to make sure if he has the aortic aneurysm, doing an ultrasound that is 100% accurate and the initial test. And then in case that we find that there's something suspicious and that yes, he does have a aortic aneurysm, abdominal aortic aneurysm, then a CT scan should be performed perioperatorily. Localize the extent into renal vessels and also evaluate integrity of vessel wall, exclude rupture. The angiography also is important to give detailed arterial anatomy. There is basically two main groups of risk factors to develop aortic aneurysm. We have the modifiable and non-modifiable ones. The modifiable ones are changes a person can make themselves to alter their risk or chance of developing the disease, the chronic illness, like smoking, physical activity, diet, hypertension, or diabetes. On the other hand, the non-modifiable ones, this person cannot change anything about it, like sex, ethnicity, age, genetic predisposition, or family history. In the case of Mr. Peacelove, he has some risk factors like smoking. He's a male over 68 years old, right? And we don't know about his family history, but we do know that he has some other risk factors like he's taking medication for high cholesterol, high blood pressure, and potentially if he doesn't change his lifestyle, who knows if he's going to get diabetes. So basically, as we could see, our dear Mr. Peacelove has all the risk factors to develop aortic aneurysm. So now what we're going to do about it? Yes, of course, that's right. Start taking away all the risk factors that could predispose him for an eventual aortic aneurysm. So he would definitely have to stop smoking and consider exercise at least 5 days a week for 30 minutes daily. Eat balanced 5 different types of vegetables and 3 to 5 different types of fruits every day. And the salad should be the biggest portion, of course, in the plate.
Oh, make completely sense. Now I know what I have to do. Whoa, thank you, doctor. Toby, you are the best.
You are very welcome, Mr. Peacelove. My pleasure. Please stay tuned for our next video about the New Start program.